Hi there and welcome back. For those of you who are joining first time, I am Hasid Thanki, the founder of presentation series called Intro to Individual Life Underwriting. Let's review prostate cancer today. Prostate cancer is the most common malignancy found in the man and is the second leading cause of cancer. Now, without going into the anatomy and physiology, I am going to give you some overview of what are the pertinent aspects that you would want to make a note of and pay attention to as you do the life underwriting while reviewing prostate cancer cases and what to look for in the medical records. So with that, there are few basic things that we all need to pay attention to. And although there is a digital rectal exam out there, but statistically speaking, PSA and TURP have increased the detection of early CAP or the carcinoma of prostate. Statistically speaking, you will rarely see anyone being diagnosed with prostate cancer under the age of 40. Unfortunately, having said that, the number goes rapidly above every decades and it keeps rising. So something to make a note of it. Now you may see in the medical records what is called prostatic intraepithelial neoplasia. Typically all the underwriters would say PIN, P-I-N. That's a pre-malignant finding on the prostate biopsy. And again, even in that category, you can have grade 1 to 3, grade 1 being considered as low, 2 and 3 accordingly high. So something to make a note of it. And another terminology that you may see in the records, that is known as ASAP, not as soon as possible, but atypical small acinar proliferation. And again, that is associated with a high risk of cancer upon rebiopsy. And as we know, family history increases the risk of prostate cancer. I believe we have discussed this when we were reviewing the family history session. Anyway, moving forward, you may not see every day on every app underwriting prostate cancer cases. However, subject to your company specifics, age and amount parameters, you will routinely see PSA while reviewing the routine lab. Okay, so let's take some time to talk about the PSA. When we say PSA, that is non-specific, unfortunately. So it may be elevated even in a benign conditions like a BPH, benign prostatic hyperplasia. Now, what happens is this, that take any manual, any literature or any company specifics, you will notice that as we age, the acceptable upper limits of what is considered normal PSA also increases. Why? And the reason is, as we age, the size of the prostate increases. So that's the reason why you would see that upward trend. However, there are parameters, so it has to be age appropriate. But if you want to just make a note of it, there is a trend that you will see upper limits of normal increases as you age. And the reason being, because with the age, the size of the prostate also increases. That's the point. Now, typically what happens is we start underwriting, sometimes we look at these PSA readings on the lab and we just jump to the conclusion looking at our manual that this is plus 50 or whatever the case may be, but pay close attention to the lab slip. What is the current medication that has been taken by the proposed insurer? Because you need to then double the readings that you are looking at to arrive at the right and the appropriate risk assessment. That's something important that generally it may be missed by even those who have been doing this for many years. So pay attention to the medications that has been admitted on the lab slip. Now, as we are talking about prostate cancer, so let's talk about the staging. And as we have reviewed before, you will see here the TNM system. So follow the TNM system, and staging could be staging stage A to D, A being the low stage, low mortality, going all the way up to D, high mortality, high risk. And what it means is tumor could be incidental finding that involves one lobe or maybe both lobes, or maybe confined to the prostate gland, or extends through the capsule, and or invades to the adjacent structures, and or to the lymph node, and or to the distant metastasis or the spread. And that's how the mortality goes. So you need to watch out for those details: pathology report, oncology report, medical records that you are reviewing. Another unique aspect while underwriting the prostate cancer is the Gleason system. That boils down to the differentiation of the tumor. So if you see the Gleason score of up to 6, that is regarded as favorable. So you can have a well differentiated equivalent to Gleason score of 2 to 3, moderately differentiated, that could be Gleason score of 4 to 6, or poorly differentiated, that could be from 7 to 10. So that's the important aspect when it boils down to the differentiation of the prostate tumor. Now, talking about the treatment, you can have a surgical approach, you can have a non-surgical approach. There are debates about the observation, but if you have insured over age 65, subject to certain terms and conditions, there is a way that you can have a wait and watch approach, the observation. That route can be taken by the oncologist. So that is considered as one of the treatment. Now the second aspect is about the surgical approach. So if you see the prostatectomy or the surgery, post that the PSA should be undetectable. Make a note of it. Now there could be a radiation, and radiotherapy, it does not completely destroy all the cells. So you will see some low level of PSA, and I'll come to that in a moment. You can have chemotherapy. Unfortunately, prostate cancer is poorly responsive to the chemotherapy. Estrogen therapy is now little used. Okay, something that you want to know. Now, depending upon the treatment and when you try to correlate with the PSA readings, one key element to connect and correlate is what we call PSA doubling time. Okay, so PSA doubling time calculator. So familiarize yourself with the manual and your company specifics and how to plug those details as you look at the various readings from different dates as it boils down to the PSA readings, because that is what you want to look into. Now, one important aspect to remember from underwriting standpoint is the fact that this PSA doubling time is to monitor that there is no recurrence of the prostate cancer following the treatment. So this is not something to be used at the time of initial diagnosis, and that's not the purpose. So just make a note of that. And as I was saying about the surgical or the non-surgical aspect, so number one, if you see the surgery, PSA should remain undetectable. If you see, let's say, radiation, so radiation, the tissue will still remain there, and it may take from 12 months up to 24 months to completely see the lowest PSA level. So statistically speaking, many companies would say that less than 0.5 talking about the radiation therapy, post that treatment, less than 0.5 is considered best prognosis. If you see in the records that it goes like 1.0 or above that, more than that, then there is a risk of recurrence. So cases like those, prefer to postpone. That's the best thing you could do at that point of time. So you need to wait 12 months, 24 months and see how it goes and plug those details. So how do we underwrite? Correlate all these details, follow your life underwriting manual, and follow your company specifics. Given we are doing this intro level, so I will start here, and when we meet again, we will start with coronary artery disease. Until then, take care. Bye now.